Living with daily persistent pain is exhausting. Even the thought of overcoming our pain seems insurmountable. Understand why pain is complex and learn actionable steps that will improve your quality of life. Now let's join Amber Kylick on A Path from Pain.
So right off the bat, hit that subscribe button because patient-centered care is what we're chatting about today. And really, it sounds like a no-brainer. Patient-centered care should be what care is. But you've likely experienced the opposite before. The doctor that's too busy and offers you the prescription too fast, or maybe the physio that has 4 patients going at a time. I've written before about the lack of persistent pain training that the medical community actually has. But today I want to open the discussion about how we're treated as patients and what patient-centered care truly means. Because I believe that we, as the patients, need to start advocating strongly for this type of care. And yes, before I go any further, part of the mental load that heightens our pain experience is this burden of having to advocate for ourselves. I understand. The good news is that if you're currently listening or reading this, you've been learning. And the more you learn, the easier it is to advocate for yourself and your loved ones. To clarify, it really should be called person-centered care. The word patient comes from Latin, patiens or pator, to suffer or bear. The patient in this language is truly passive, bearing whatever suffering is necessary and tolerating patiently the interventions of the outside expert. Person-centered care is no longer considered passive and creates a more active involvement from both sides. The person is not just sitting there tolerating the interventions, but discussing the implications before and during with the medical care provider. So what is person-centered care? The basic answer is that the medical professional works with you to listen and inform you of your choices and helps you build your plan. Think of this. Have you ever been to a physio and they give you a sheet with a bunch of exercises on it? Some of which either you don't fully understand or the exercise itself causes you more pain or discomfort? One of the best examples where I've personally had this happen was in the depths of my back pain. I'd finally gotten into a pain clinic and I was so hopeful that I would be heard, given explanations, options, essentially a path forward. Apart from the physio assessing me and then turning around to tell the doctor that my glutes were weak, as you know, one of my biggest pet peeves, there was the exercise therapist at the end of the appointment that sat me down and handed me a sheet of paper with some exercises on it. Didn't take me through them, just handed me the sheet. Now, I'm not one to just walk away, which is what probably 95% of people would do. But when there's an exercise on the sheet of paper that I knew I couldn't do, I asked for a modification or an alternative. They had nothing to say, except for, keep trying. Those 2 interactions left me feeling unheard. My pain was looked over. The impact of living with daily pain was not even within their scope of perception, and I felt deflated. I wasn't going to find my answers there. What would have brought the situation into a more person-centered focus? At the very least, the exercise therapist would have taken me to the floor to look at my movement patterns for that one exercise to help me actually learn to do it, or offer me a modification that still targeted the muscle group and or movement pattern. And that would have been the very least. If it was true patient-centered care, there would have been a discussion about my life, what aggravates my pain levels, my goals. There would have been a bit of education, maybe, about why my back pain has become what it is. There would also likely be a little psychological learning and discussion about the role the nervous system plays in my experience. And there would be a discussion about what I do want in my life activity-wise. Different lifestyle modifications that would either be temporary or permanent. There would be an alliance created between me and the clinic that if I had any questions, I knew where to go, who I could ask. I would have left feeling I was heard and the impact of the pain in my life validated. Now, I know what you're thinking. All of the appointments would need to be so much longer. Yes and no. The initial one 3 years prior with my family physician, yes. Here in Alberta, the time given for a family doctor visit is 10 minutes. 10 minutes. I was talking with a doctor from the US during a workshop, and I had mentioned this. She was appalled. There's no way to build a relationship in 10 minutes, let alone get enough information to have half an idea of what the patient is going through. The pain clinic appointment was almost an hour in length because between the physio assessment, the doctor appointment, and the brief talk with the exercise therapist, there would have been enough time to build some rapport and truly listen. And part of this is education on both sides. We continue to learn from research and science, and as a medical professional, this isn't easy to keep up with sometimes. There's just so much. But if you're in a career that is constantly growing with information, you need to figure out a way to continue to learn. I have empathy for those in the medical system. They went through school for years, committing a huge chunk of their lives to learning. They complete their schooling, open an office, and want to have and build their own lives as well. It's not easy. We need to build a system where people are heard, asked for more information, and given answers that opens a discussion for a path forward. In relation to working with people who have been living with persistent pain, this system involves more mental health referrals, a system where we can grow and learn, not just chase the fix of a structural issue. We put the medical system up on a platform. We've been conditioned to believe that they have all the answers, that they are the help we need. The truth is, no one can know everything. But together, being given the time to talk about the experience that you're having in your body, their knowledge and guidance, both parties asking questions helps to build a better system for care. Now, does this even matter if we build this better system of care? An amazing physio that I have had the benefit of learning from, Ben Cormack, states it this way. Although we don't really have much data currently, my biases say that for many it would make a difference, if not to common outcome measures, then to the person's experience in the healthcare system, which might be an outcare measure in itself. I can only speak from my experience and the many conversations that I've had with clients about their experiences. Yes, if there had been a little more listening, a little more time spent to understand, there would be increased benefits in the outcomes. Ever since I've been living with back pain and studying the complexities, I've also been working toward building that stronger patient, person-centered care relationship. Seeing each person I work with as an individual, learning how their pain or disease has affected their lives, and what they're willing to do to build their path back to wellness. All based on the individual that I see in front of me. So often while working with clients, they come to a session with something extra, and I improvise. We work on the new thing, plus continue to build with what we've started. We talk. I offer explanations about different aspects of what they're experiencing. No, I'm not a doctor or a physio, but I know a little bit about anatomy, physiology, biomechanics, movement, life, the mental load that comes with persistent pain or disease, and a few other things. If I don't know, I go learn more. Afterward, everyone who works with me or has ever worked with me knows that they can reach out at any time to ask me something. I'm their support. Sometimes I even work with their caregivers to help them. I offer education and knowledge about what's going on. I listen to their frustrations, experiences, and more. I do believe that it helps that I've had and still do have the experience of living with pain. I do feel that those in the medical community that work with persistent pain, that have never had to live with daily exhausting pain, have a harder time understanding how pain can affect life so much. This brings me to one more story, another pet peeve, the pain scale. And this is for all who are living with high mental loads of pain, as well as the medical staff that have scoffed at the answers of people living with pain. There are times when a person answers that their level or experience of pain is off the scale, be it an 11 out of 10 or a 200 out of 5. And then the medical practitioner belittles that and scoffs at it. I could punch someone. If you know that the mental load of pain influences the experience of pain tenfold. This goes the other way as well. As I was learning more about pain and the impact of it on your mental load, I had a nurse ask me where I was on the pain scale. Honestly, at that time, I was able to separate the mental load from the physical sensation, so I answered her a 3. If I hadn't been able to separate those two things, I probably would have answered her a 7 or 8. Now, my 3, that was barely enough for the treatment at the time, but that treatment that I had was very helpful because as much as the mental load contributed, there still were structural issues that I was dealing with and still do. So where does that leave us now that we've opened this can of worms? Take your time to learn. Advocate for yourself. And if you're overwhelmed, take someone with you to your appointments. It isn't easy, but we deserve better. And never, ever forget to take a breath. Honestly, I could talk about this for hours. Remember, complex pain is not black and white. Everyone who experiences daily pain is unique and deserves to be heard so that you can learn to build a path from pain. Interested in learning more? I have some articles written up on Substack, my YouTube channel, Critical Movement YYC, or join me for the free 5-day Change Your Pain program. You can even message me and learn how I can help you build your path from pain. Either way, go hit that subscribe button. If you like this episode, let me know why in the comments below. If you learned something that's helped you, write it down in the comments below, or consider supporting this podcast to help me keep producing content that can help others. And please share this episode with a friend. Word of mouth is my best friend. Thank you for listening.